Welcome back. This is Dr. Marianne Iskander with Practically Pediatrics. Today we're going to talk about something a little taboo, itchy privates in girls, namely. Summertime is the time where we get a lot of issues below the waist in girls. If you are a parent of just boys, you can probably skip this one because we are going to talk about female genitalia. We're going to be using words like vulva and vagina. So if that bothers you, grow up. So we're going to talk about issues in that area, and then I'm going to piggyback on that and talk about UTIs, which are also very common in females. Let's get to it. If your little girl comes to you and says, "Mom, I'm feeling a little itchy and it burns when I pee, help me, what do I do?" Moms really kind of don't know what to do with that because your mind goes to the worst place possible. However, just know that vaginitis and vulvovaginitis are very common, number one, throughout the year, but extra common in the summertime. Why is that? Because the weather is hotter, there's more sweat happening, and that area tends to be pretty sensitive in girls. And if we are not on the up and up with our hygiene, if you're not bathing your child every day, especially if your child has been in a pool or in a bathing suit more than usual, of course, our private areas can get a little irritated. Another cause of vulvovaginitis is bubble baths. Think of chemical contact, so pools, the ocean, sand, chafing, heat, and sweat. Also, if your child is potty trained, especially newly potty trained, and they are finally using the restroom alone and they are wiping themselves, that is also a risk factor for vaginitis because sometimes they're not wiping efficiently or enough or at all, or they are wiping too hard, or they are leaving little pieces of toilet paper behind, which can all irritate that area. Every once in a while, go in there and just check their wiping technique. Make sure they are wiping front to back and they are wiping efficiently in order to avoid further irritation. So number one, how do we diagnose it? You can do a quick inspection of their lady parts. So you can look at the labia majora. Sometimes the labia majora will also be irritated and red. You can also open up a little bit and check out the vaginal opening and the labia minora. And if it is really red inside, especially if they've been itching, that is most likely vulvovaginitis as opposed to a urinary tract infection. It's very easy to treat. Number one is avoidance. So if your child does like bubble baths, you can skip the bubble baths for a few weeks or just have it once a week as a treat. You can also give the pool and the bathing suits a rest for a little bit. And then you can also try to change your soap. Because that area is a little sensitive in some girls, you can just stick to sensitive soaps like Cetaphil or CeraVe or Dove. You can just pick up hydrocortisone cream over the counter. It is safe for the private area in females, and you can apply it twice a day on the labia majora, and it's also safe inside around the labia minora as well. Once in a while, if you're also getting odor in that area or some discharge in the undies, you can also sometimes add an over-the-counter antifungal. There might be a little yeast component, and that's safe to use too. Obviously, call your doctor if you're going to use any medicated creams for guidance. Now on to urinary tract infections. Urinary tract infections are one of the most common bacterial infections in females. What are the signs? So it's kind of similar to vulvovaginitis. So it will burn when they pee. Not so much itching, but they will be uncomfortable. They're really not in pain unless they are urinating. With vulvovaginitis, they're kind of uncomfortable all the time. With UTIs, it is only pain on urination, and the pain will be a burning pain. The second thing you might notice is frequency. So they will be running to the bathroom every 30 minutes, 45 minutes, sometimes Girls will start having accidents, urinary accidents. Sometimes they will wet the bed overnight. That is a sign of frequency, and it's also a sign of urgency, which is the third component. Urgency is, I have to pee, and I have to pee right now. If I don't get to a bathroom now, I'm going to have an accident. So it's really hard to control the urine from coming out. And then the last component is hesitancy. So finally they say, oh my gosh, I have to pee, and I have to pee right now. And they finally get to the toilet, they sit down, and as much as they feel the urge to urinate, they can only pass a very small stream or just a few drops. With the UTI, you can also get lower pelvic pain. The later sign is actually blood in the urine. If your child is having recurrent urinary tract infections, we might have to look at the urinary system. The workup starts to get a little more extensive with some imaging. You also want to look at hygiene. Make sure they are wiping the correct way, because we don't want to tract feces into the urethra, etc., etc. So there does come a point in your child's life that they do need to bathe every day. They do need to practice good hygiene independently. You want to encourage them to not hold their pee when they need to pee, just go right away. And also, and I mentioned this in the abdominal pain video, if they tend to be constipated, we have to fix the constipation, because the constipation could be a cause of urinary tract infections. If you have left it to go a little too long, you might also be getting back pain or fever. That is a medical emergency. You need to call your doctor right away, because that infection may have gone from the bladder up to your kidneys, which is a much more serious infection. Urinary tract infections can usually be diagnosed and treated as an outpatient, but we do need to test that urine. So call your doctor right away if your child is having signs of a urinary tract infection, because we don't want it to turn into a kidney infection. Can boys get urinary tract infections? Of course. However, it is very rare after the age of 2, especially if you are a circumcised male. If you are not a circumcised male, still after the age of 2, not as common in boys than it is in girls, and that just has to do with anatomy. Thank you very much. I hope that helped, and I will see you soon. Bye.